be first time.
Yeah.
You guys ready?
So you're talking to us about the virus, right?
Right.
What are some of the concerns that we have about the virus?
I think the biggest concern with the virus right now is really about the concerns with pregnancy, and it has been noted that there's a significant correlation with the rate of what's called microcephaly in newborns when women have contracted this virus during the pregnancy.
What are some of the things that pregnant women need to do to protect themselves because they are the most at risk?
Well, you know, that in the United States, the risk is probably minimal at this point because we don't have any reported incidents of local transmission, and all of it is travel related. But from the standpoint of mosquito risk, it is wearing clothing that protects you from mosquito bites. So long sleeves, long legged pants, and then using clothing if you're in high areas with a lot of mosquitoes that are infused with insect repellent. Insect repellents that are appropriate to be used during pregnancy, and staying as much as possible in areas that are air conditioned with screens.
So just a little bit of background information on the virus. We've actually known about this virus for decades. It was first described in 1947 in Uganda, and it caused sporadic disease throughout Africa and parts of Asia for several decades, and then really came to our attention kind of at the last part of the last decade when there were large outbreaks in Micronesia, French Polynesia, and then has really exploded in the tropical areas of the Americas here over about the last year or so. And so everybody's familiar with the large outbreak that's going on in Brazil and other areas of tropical South America and the Caribbean. And again, the big concern is with pregnant women. For other people, this virus has very little impact. So 4 out of 5 people who get infected with this virus are actually totally asymptomatic. They don't even know that they had illness. And then the other 1 out of 5 people generally has a relatively mild disease characterized by some headache, rash, fevers, and then some muscle and joint pain, and then sometimes some redness around the eyes. This typically runs its course over a few days to maybe as long as a week or so, and then goes away. So again, for most people, the illness is either totally asymptomatic or is very mild. Now, as Dr. Berg related, the real concern comes with the developing fetus, and so pregnant women are obviously very, very concerned about this.
If travel is your biggest concern, what advice do you have for people who are traveling to areas where the infection is prevalent?
Yeah, so I think that's a great question, and again, in the United States now we have no transmission of this virus. So anybody who's going off this weekend and taking off to other areas of the country, there's really no concern about mosquito spread Zika virus. If you're going to one of those areas such as the Caribbean or South America where there's a spread of the virus, you do have to be concerned. And so Dr. Berg again has already related some of those precautions that people should be taking. And actually, I'll turn it over to you, Teresa, if you want to talk about precautions that people should take if they are trying to conceive after potentially traveling to one of those areas.
Yeah, and unfortunately, we don't know because we assume that first trimester risk is always the highest for the fetus, but it doesn't really appear that that may be true with Zika virus. It appears that it could be affecting fetuses in the second and maybe even the early third trimester. So exactly the timing that the effect is the worst, we're not certain of. We also know that it is transmitted from sexual partners. That's been documented through the CDC with travel also. And so we want pregnant women or women who are trying to conceive to be careful around with their partner's travel also around the issue of whether or not they could get infected. I think currently in our community, the people that have been the most concerned have been from the Air Force Base with required travel with jobs, and whether or not their partners are putting them at risk when they return home. And so there is not certainty about how long that virus is present, and so you have to be careful not only of yourself traveling as a woman, but also with your partner's travel.
Is there anything that could be done to protect a developing child if a mother has been exposed during pregnancy?
Well, you know, we know that the rate is increased from microcephaly, but we don't know to the degree that the rate is increased. We don't know if it's, 1% of babies are affected or 15% of babies are affected. We really don't have that number yet. So we do recommend prescribed testing through the CDC if we think that someone might have been exposed. And that has changed multiple times in the last 3 to 4 months. And then we also talk to most people, if we are concerned about exposure, about having serial ultrasounds to look at size of baby's head to see if we are seeing any effect.
I think what the authorities are saying and what the public needs to recognize is that this is a relatively fluid situation, that we don't know everything there is to know about this virus, even though it's been around for decades that we have described it. We clearly have still some questions that need to be answered. So as Dr. Berg related, the absolute risk to a woman who is pregnant and gets infected with this virus is not known. It is significant, however. I've seen statistics anywhere from 1% to as high as 20% may develop microcephaly. There's also probably a spectrum of fetal abnormalities that go along with this infection. So everything from the most severe case of microcephaly to perhaps much more mild fetal abnormalities. So there is a spectrum of disorders that are being described with that. Something that is also of concern for non-pregnant adults and other people is that there is some association of this virus with a relatively rare musculoskeletal disorder that's called Guillain-Barre Syndrome. So this is an ascending paralysis that you can get in response to infection from this virus. That seems to be quite a very rare complication of the infection, and it has been linked with lots of other infections as well.
So both of the things you've discussed here, the encephalitis and the Guillain-Barre, this virus attacks nervous system, or is there a certain place that it targets in people?
Yeah, so there's a clear neurotropic process with this virus. So in other words, it does infect nervous tissue, and so with the developing fetus, it obviously can be very devastating. For most adults, it does not have neurologic complications.
What is the likelihood, as it's not prevalent here, what is the likelihood, Dr. Rupp, of this disease spreading here in the States, especially in the modern world we live in where there is so much travel?
Well, we think that conditions in the United States will not be nearly as predisposed towards transmission of Zika virus. There are differences in the public health infrastructure. There's differences in many of our communities with regard to living in better housing, with screens that are intact, living with air conditioning. So mosquito-borne diseases we think will typically not be as severe here as they are in other parts of the world. In addition, there's 2 viruses that are very, very similar to Zika virus that have been in the Americas now for some time. One of them, your viewers probably are a little bit more familiar with, called dengue fever. And then there's another one that sounds a little bit more exotic and has only been in the Americas for a few years, called Chikungunya. Now, Chikungunya, very much like Zika, came into the Western Hemisphere just a couple, 3 years ago, really exploded on the scene. There have been millions of cases that we think have occurred, and it has not spread in the United States. We've had just a few little sporadic cases of local transmission in Florida, and that's pretty much it. Likewise, with dengue fever, there have been a few little cases along the border towns between Texas and Mexico, but it has not spread throughout the United States. And so I think those 2 viruses are really good models for what we can expect to see with Zika virus this summer and in coming years. And that is maybe some limited, sporadic, local transmission in areas that are very warm and have large populations of mosquitoes. I don't think it's going to take off here in Nebraska or other parts of the U.S.
Getting ready, obviously Memorial Day weekend is a huge weekend. Mosquitoes are coming out. You've reassured us lots of times that there is no worry in Nebraska, but people are worried. They need to protect themselves. You named it, mosquito, clothes and stuff. Is there anything else that people just need to be aware of going into the summer and these next months where mosquitoes are really bad?
Well, I think that, I mean, you know, I don't think that we wear as much mosquito or insect repellent as we probably should or could. And there are safe repellents to use during pregnancy. You don't want to use DEET, just like you don't want to use a lot of DEET on children because of the symptoms that people can have with excessive exposure to it, especially small children. But there's other, the promethium, am I saying that right?
Permethrin,
yeah. Insect repellents that are reasonable and safe to use in pregnancy. And you can get your clothes, you can get clothing that's infused with that, and you can get solution to infuse your own clothes with it as well. And it tolerates a few washes too, so it's not like you have to do it every time you wash your clothes. And those things are going to make a difference if you're outside a lot, to just decrease the number of bug bites you'll get.
So during the summer, as you've mentioned, we come into that season where we see insect-borne diseases. So tick-borne disease, mosquito-borne disease. Clearly, there are some common sense things that people can do. And in our area, we're obviously much more concerned about West Nile virus, for instance, than we would about Zika virus at the present time. West Nile virus has devastating complications in normal adults, and so this is something that people do need to be concerned about and take those precautions. So wearing some loose, cool, long sleeve, long-legged clothing, using mosquito repellents. My understanding is if used by the label that's approved by the EPA and the FDA, that all of these repellents are safe for use in all adults. So I would say that using those precautions to prevent mosquito-borne and tick-borne disease is really the watchword. The message really needs to be a measured tone of concern that local transmission of this virus is not being seen, is likely not to be a real problem here in Nebraska, that there are reasons that you should take precautions against mosquito-borne disease and tick-borne disease here as we enter the summer, and I think that's something that should be emphasized. And then if you are pregnant or are trying to conceive, this is of concern, particularly if you're going to travel to an area where it's being spread or your partner has gone to those areas. One of the things that we didn't talk about specifically is the time period that people should delay conception if they are at risk. And my understanding again is that this is changing somewhat as we learn more about the virus, but it's been recommended that if you have traveled or have a partner that has traveled, that you delay conception for 2 months until we think that virus is really out of your system. And I think that's a very prudent measure. Obviously, people need to be aware of this, be using contraceptives to prevent conception during that risk period.